Okay, so I'm gonna present different strategies that we try in a farm. So in the last years, we have improved our capacity of sampling a farm, like being better and capturing what is happening in a farm, and the use of pooling techniques and also raw fluids made us like do faster diagnostics and cheaper. But we are still in need of improving those sampling techniques and try to get a better sense of what is happening in the farm. And also, if we could use those jobs or those cores that we are doing in the farm in a regular basis to make it simpler, it would be great. And also, if we could use some sampling techniques that we did in the past, as for example, for PD, we're using environmental sampling. So using that as a background, the goals of this study were to evaluate different strategies. We were evaluating the processing fluids, the fluids that are at the bottom of the tail pail, where you throw your testicles and the tails in the processing. And also we evaluated environmental samplings, and I will talk more about those, and also sampling, considering the sow as a sample. So in this study, we evaluated sensitivity, specificity, the effect of parity on some of those samples, and the effect of the time from the infection point. I divided this study into parts. I'm going to talk first of the processing fluids. Later on, I'm going to talk about the environmental samplings. So the study design is very straightforward. We were looking for a farm that was in status 3 or 4 according to the ASB, like was provisionally negative or negative. And then after the outbreak, we went there and we were going to sample every 3 weeks. You can see that here then they did the virus inoculation after weeks 5 and 8 after the outbreak. And then we had 8 sampling points during the whole period. So that was covering more or less 6 months. So then what we did, so we were there, we were bleeding, we were selecting 10 liters per week. We were trying to capture a little bit of all the parities, so it was a convenient sampling. We were trying to also to spread the sampling across the room. And then we were bleeding all the piglets in the litter, and that we were using that as a gold standard. And then we were collecting the tails and the testicles of that specific litter. We were putting all those tissues into a Ziploc bag, and after a couple of hours, we were taking that out with a pipette and putting it in a tube, centrifuging at the farm, and then taking to the lab. Because we were foreseeing that at the end of the study, the prevalence was going to be low, we also wanted to expand or try to get a better way to know what was happening with the disease. And after the week 3 of sampling, we were collecting all the processing fluids that they were processing that specific week, the specific day that we were going to the farm. So in that period, we have an extended amount of samples. This is a summary of the samples that we collected across this study. We collected around 900 piglets. We collected 77 liters that were paired to those piglets. And also in the extended sampling, the 3 weeks are the same as we were saying. We didn't collect more samples there, but then we extended the sampling liters and we reached 175 samples for that extended sampling. So these are the results of the pair samplings, sensitivity and specificity of the blood and processing fluids. So we have the litter status. We consider a litter positive if at least had 1 piglet positive, and then we consider the processing fluids positive. We had to decide a CT cutoff value because it was some samples that were falling in the range of suspect. So we decided, according to what we were seeing, that it made sense to use a 37.5 CT value as a threshold. So we're seeing that we have a sensitivity of 83%. You see the interval confidence. And also the kappa was at 0.76, is a measure of agreement. That is a very good agreement with this type of sample. If we look at the percent of positive samples since outbreak, through all the weeks post-outbreak, what we are seeing is we are capturing that the disease is disappearing every time that we have less and less positive. But we also we're seeing that, for example, in week 11, we are not capturing any piglet, any processing fluid that was positive, but also we were capturing some positive piglets there. If we compare the two processing fluids, the one that I showed you before that had 77 with the extended one, we're seeing that we are capturing better the disease, and that week that we had no positive there, and now we are able to capture that we have a 4%. And also some of the weeks, what we're getting it adjusts better with what was happening in the farm. Also, you can notice that we are capturing also an increase of positive samples after the virus inoculation. If we compare those processing fluids across parity, what we're seeing is if we're putting together parity 0, considering parity 0, those gills that had their first, they delivered for first time. So if we're putting those two together, parity 0 and parity 1 versus parity more than 2, so there's a significant difference between those parities, meaning that those could be the ones that we should target if we want to know the status of the farm. Also, we ran the same test comparing parity 0 versus parity 2 to 6 and parity 1 versus 2 to 6, and also they were statistically significant. If we divide this by parity and also by time, and you can see here positive samples are red, negative samples are green, and you can see inside of the column that the number of samples in each category. So we're seeing that over time, the ones that are remaining positive, or the ones that are keeping the disease, are the parities, the low parities, 0 and 1. If we compare the CT values between the two types of samples, so we can see that in orange we have the serum, all the samples of the serum, and there's a bar marking the average, and in blue the processing fluids that correspond to those liters. We're seeing that at the beginning the CT values are lower at the processing fluids. We're seeing a dilution effect there, and also we're seeing that is not, I don't think that has a biological explanation yet, but we're seeing that the processing fluids have lower CT values at the lowest part of the disease. That might be associated with the type of parity that we are detecting. Then we wanted to test this pooling effect. If we were losing capacity, if we were losing that sensitivity of this sample type. And what we did is we selected 3 different samples of processing fluids that were in the range of these categories, under 21, between 21 and 25 CT values, and between 26 and 28 CT values. And then we diluted those processing fluids with negative processing fluids of the same farm, and we diluted 10 times, 20 times, 30 times, 40 times, 50 times, and then we are seeing that we are not losing that much. Where we are losing the most of the sensitivity is after the first dilution, but then the dilution, the capacity to detect a positive sample remains the same. And this is all about the processing fluids. Now I'm going to talk about the environmental sampling. The design is the same. We were using the same wicks, the same liters as we were using in these processing fluids. We were taking into account the blood as a gold standard. And then in this environmental sampling, we were sampling the surfaces. We were we had using a wipe with a medium that prevented bacterial growth. We were wiping all the surfaces that were in contact with the piglets. We did that with the udder, with the sow. We were using the same type of wipe with a medium. And also we were lying down, we were putting some tin foil, 1 meter of tin foil, and we left this tin foil for an hour on top of the crate. And then after that hour, we were there and we were wiping that tin foil with the same type of wipe and with the same type of medium. And these are the results of the sensitivity and specificity of those type of samples. So litter status is the same. If a litter has at least one positive piglet, we consider that as positive. We also consider that the threshold 37.5, and we're seeing here that the agreement is moderate. It's not that good as the processing fluid. It's not bad, but still low. If we're looking at the other wipes, we're seeing that we're having the same type of agreement, like a 0.47, that it's a moderate one, sensitivity 42, specificity 98. If we compare those litters that had positive or negative surface wipe versus other wipe, we're seeing that more or less there's a very good agreement between both, but also we are detecting less and less the virus until we don't detect the virus at the end in a low prevalence stage. If we look at the particles, at the airborne particle deposition, what we're seeing that we were able to capture the virus at the beginning of the outbreak, where there was a lot of virus in the environment, but then it was more difficult to capture that, and we don't know if that was because of the place that we put the tinfoil. If we look at a comparison between sample type, we're seeing that 4 samples are able to capture that virus inoculation. After that, we're getting a higher number of positive. But then at the end, the processing fluids are doing a great job in capturing what is happening in the farm. And here you can see a summary of the 3 types of sampling, the agreement that exists between them, sensitivity and specificity. And also we tried to sequence the virus, and we succeed in sequencing the virus in all types of samples, also in the environmental one, the one in the tinfoil. I'm gonna gather the conclusions and then I'll go to the discussion. So the processing fluids are an effective sample to detect Pierce virus in piglets, included after significant time since outbreak, as we have seen, especially in litters from young parity sows. Environmental samples have lower sensitivity than processing fluids, and one limitation of this study that it has been performed only in one farm. In the discussion, well, processing fluids, as we have seen, are a very sensitive sample to detect Pierce virus at litter level. However, we were collecting also males and females in each litter, and we didn't see any difference between males and females, difference in prevalence or percentage of positive. Also, what was interesting is at the beginning we separated tails and testicles to see where the fluid was coming, and it was no noticeable fluid coming out of the tails. So then the following question would be, are you capturing the females that are positive? Yes, we are capturing the females that are positive. So at the bottom of this slide, you could see a chart where you can see the number of litters versus the positive piglets. So we had 7 litters that had 1 positive piglet, and of those 7, 2, the only positive piglet was a female, and we were capturing that. We have a hard time trying to understand that, but somehow we're capturing the virus that is in the tail. Then the processing fluids appear to be a good tool to define the status of the hair, positive or negative, as we have this power of pulling. We did not increase sensitivity by increasing sample size. In that sense, if we do targeting if we go and sample the gills and first parity sows, we can detect if the sow is, if the herd is positive or negative, but also we don't need to do that also because we have this pulling power. And then pulling processing fluids from virus litters might reduce our sensitivity at high CT values. However, it might increase sensitivity at higher level. It allows us to capture like one positive litter in a whole room, as we have seen. And then we saw this parity effect that was interesting, and looking at parity 0 and parity 1, that it was described before, but by Jean-Paul Cano in 2008. So the take-home message would be the use of processing fluids is a sensitive tool for sampling breeding herds. Pulling of processing fluids might reduce our sensitivity, as we have seen, at higher CTs. However, it will allow us to sample more litters. And then, if we target young parities, well, if we want to look for pairs, we should target young parities. With that, I would like to acknowledge Deb Murray for the idea and for helping with this study and for the discussion, and all the people that collaborated with this study, New Fashion Pork for providing the farm, and then the BI and the SDC for the funding.